And if so, would somebody like to make a motion to approve the minutes if there are no changes to be made?
I can do that. I'll motion to approve the minutes.
I will second.
Any objections? Okay, so we'll move to accept the minutes as written. All righty, so I guess Janine, will go to you.
Okay, good afternoon. I will start with the audit of 4821 LB. We paid BioServe $110 for the removal of the used needles at our clinics. We also paid Respiratory Services of Western New York $170 for renting 2 wheelchairs. We paid Say2 Rural Health Network $3,000. $500 was paid for with health department money, and $2,500 was paid by the Children with Special Healthcare Needs grant. This is a collaboration with surrounding counties, and they write and review policies in support of the regulations for the 0 to 2, 3 to 5, and Children with Special Healthcare Needs program. We gave American Food and Vending Corporation $90 back because they overpaid for a food permit. And we paid Cuga Community Health Network $7,462.51 for the month of March for helping with the COVID clinics. And we paid VIP Structures for the renovations that we needed on Dill Street to bring our license up to code for $16,176. On the credit card statement of 3/27 to 4/14, we paid Cases Unlimited for shipping some samples. We also paid the language line $593.25 for communication between Spanish and other foreign language clients that we serve. And we bought some chemicals for water tasting from Hot Company for $97.74. On the credit card statement of 4/15 to 4/28, we have $385 for Ability Network, and that was to purchase a piece of equipment for a child with special healthcare needs to attend school. That's all I have. Anyone have any questions on the bills?
Did you mean water testing or water tasting?
Water testing. What did I say? Tasting?
You said tasting.
Oh, I'm sorry. I meant
just wondering how good the water was.
Tastes great on a day like today, especially when you've been working outside, right, Brian?
Yeah, right. And it's not green yet either.
Hey, that's a good thing. Hopefully it won't turn green.
Yeah, right.
All right, thank you, Janine. Does anybody else have any questions for Janine? Okay, very good.
I do have one more thing that they would like me to address with the board. Probably a month ago, we did the fee scale for our immunizations, and we added the COVID shots, the first dose being $18 and the second dose being $30. Since then, there's been a new standard for immunizations for COVID, and we can charge $40. So we would like to revise our fee scale so that we can from March 15th going forward, we can charge $40 for the immunization shots, both first dose and second dose. So we need to revise the fee scale. And I will tell you, we just received our first check from doing this, and our first dose was $18 and the second dose was $30. So that was $48. And we received back from United Healthcare $45.85. So that was good news. So we feel like maybe all the work going towards all this insurance billing isn't for nothing, I guess. You know, we might recoup a little bit of money for the county.
So Janine, just to clarify, my understanding is that the vaccine itself is free. It's the administration fee, which is being charged to the insurers. And then if a patient is uninsured, what are we doing?
Nothing.
Oh,
You can't go. This is just, the government said that we could charge for the admin cost of the vaccine. And we are not allowed to go after them for any co-pays, high deductibles, any of that. If their insurance only pays $2, we cannot go after them for anything. So it's just, we have to make an effort that we are billing the insurances, because state aid and FEMA and some of the monies that are available to us are deficit funding. So we have to make an effort that we've exhausted our sources that we could have maybe got some money through.
got it.
All right, so I guess we'll start by making a motion to accept the claims as written. Would anybody like to make that motion?
I'll motion.
I'll second.
Very good. Any opposed? Okay, so we'll move to accept the claims as written. And then on the second, revising the fee scale for the COVID administration, would we, I'll make a motion to accept the revised fee schedule for COVID vaccination. We'll need a second.
I'll second.
Anybody opposed? Okay, so we'll move to accept the revised fee scale. Anything else for us, Janine?
No, that's all I have. Thank you.
Very good, thanks. All righty. We'll move on to Tanya.
Hello. So some quick updates. Oh, there we go. I'm pretending I'm on vacation as well as I'm here in the office. Our March caseload was about 1,360 participants, which was up again this month. Things that are going on here. So the public health emergency, as you guys know, was extended. So we're not going to be required to see participants back in the office probably until mid-August, but we are working with Nancy Purdy in our regional office, hopefully to do some sort of soft opening here pretty soon. We do miss seeing our families, and we think we can do it safely now. One of the big things that is coming, there's going to be an increase to the fruit and vegetable benefit for children over the age of 1 and women. So it's going to go from either $9 or $11 a month to $35 a month, which is a huge increase. And that's going to be from June until September. So we really want to encourage, we're working on education about buying fruits and vegetables, storing them, cooking them, food safety. We really want to encourage our families to take advantage of that on WIC for the summer. We also are going to be starting farmers market again. And I should have reported on this a while ago, but we did get our report back for farmers market coupons last year. The redemption rate was down a bit, but there was just over $5,800 that went back to local farmers from the WIC coupons that we issued. And this year we're hoping to do better than that, which is exciting. And I think lastly, I know Kathleen briefly mentioned, I think last month, but we're continuing to work on our plans to move our site location to locate with ABC Cuba. Everything seems to be going pretty well. We're just still working out some of the details. That's all I've got.
Very good. Thank you. So right now you're doing most of the visits, I guess, by telephone or virtually, right?
Yeah, right now we are doing most over the phone. We don't do any virtual.
Okay. And that's going to continue that way at least until August, you said?
We have the ability to continue that way. Yep.
Okay.
We
And you
also
guys
have,
sorry, you guys are already a lot busier this year now than you were last year at this time?
yes.
Okay. All right. Okay, very good. Thank you. Anybody else have anything for Tanya?
I've got a question, Tanya. I'm encouraged and interested in the local farmers market program. I'm wondering what sort of educational outreach you're doing for that, for both the farmers and the WIC recipients, and whether those coupons are then basically null and void if they're not used.
Right. So if they don't get used, they just don't get used. And there is some education that here at the local agency, we provide the education to the participants about how to use them and how to shop for local fruits and vegetables, which where the farmers markets are, when they're open. I think the New York State, I don't want to say the wrong thing, but New York State Department of Health works on the farmer side and educating the farmers on how to get the requirements to receive these coupons. They have to do a little bit of a registration process from what I understand. I did just talk to Auburn Farmers Market, and the manager there said that all the farmers at that Auburn market who do fruits and vegetables are registered to accept those WIC coupons. So that's pretty impressive. But did I answer your question?
Yeah, pretty much. I think it's a great nutrition program, and I think it's a great way to really get those funds to local, producers and get everybody invested in this. I just want to see it really, pushed as much as possible from both ends, both having the farmers understand that this is good for them and good for everyone, and of course having the recipients really take advantage of it.
Yeah, I appreciate that. And we are hoping to work with Cornell Cooperative Extension as well for some education and doing some promotion down at the market with that as well. So thank you for that support.
All right, thank you. Thanks very much for the update, Tanya. All righty, so we'll move on to Eileen.
Hi, good afternoon. So first I would like to introduce Ani Fish, who's listening in, and I don't know if she's in the middle of lunch, if she wants to show her face or not, but Ani is a new hire in environmental health. She's an engineer, so it's so awesome to get to be working with her. I've been enjoying it very much for the past couple months. The first thing I wanted to go over consent orders. So the first one is with KFC. Back in April, they were found in violation that 2 male employees were observed not wearing a face covering properly, and they paid a $50 fine. The next is with the IOOB Club, where they did not take their 2020 nitrate sample as required. And also they failed to submit their operating reports in a timely manner by the 10th of the following month for 3 months. So they did take a sample in January that we're going to count for 2020, and then they have to take another sample this year. And also they posted notification regarding their monitoring violation, and they paid a $50 penalty. The next is with the Fillmore Golf Club. They failed to submit their water operation reports by the 10th of the month for 5 months in 2020. And they also totally failed to submit the one for September 2020 report and paid a $50 penalty. And then the last one is with the Auburn Smoke Shop, a new vape shop that just opened up, where we sent a person in, an adult, one of our staff members, to buy flavored vape product, and they sold it to us, which is against the law. And also they didn't have a local license. So they did sign the consent order. They paid a $150 penalty, and they did submit their local retail license application to our office. Any questions on those?
So they were operating without a license?
Well, they're operating without a local license. So we are unique. Cuba County does require all tobacco vendors to get a local license in addition to being licensed by the state.
And are we still going to do mask violations now that the state has changed its tune a little bit on mask usage indoors?
Well, probably not. If it's allowed, it wouldn't be a violation anymore. And that's really confusing because the governor's message really wasn't clear yesterday on exactly how people are going to, are restaurants going to require people to show a vaccination? Because it says if you're vaccinated, you don't have to wear a mask. And if you're not vaccinated, you still have to wear a mask. So we're waiting for guidance from the state, and we're getting a lot of calls.
Now, if I'm not mistaken, I think the state also says that a business can choose to require masks of their customers. So I would still imagine that there might be scenarios where somebody walks in maskless, but the sign on the door, for example, might require that patrons wear a mask inside, right?
Correct.
And that's all up to individuals, but I think with the public now under the impression that the mask mandate is going to disappear, I would think it would be difficult to cite people and give them violations for that.
Well, we wouldn't be able to. So if a business has their own regulations, if they still want to require masks and somebody doesn't, that wouldn't be our violation. Right. If masks are not required anymore. So. Yeah.
I mean, as a for instance, though, there's a carve.
We do have.
There's a carve out for medical offices, and certainly in a medical setting, there could easily be people who are immunocompromised due to things like cancer, et cetera, who are in the waiting room who might be harmed by somebody walking in maskless. And so it is still important to sort of emphasize that in certain environments, a mask can be required.
Right. Absolutely. Yeah.
Eileen, are we waiting for, excuse me. I was wondering if we're waiting for direction in the form of an executive order or a memorandum from the Department of Health. What will determine the actions of the local Department of Health?
Yeah, we're waiting for something other than just a press release. A press release isn't really enforceable. So we're waiting for something in writing from the state that's an official guidance or executive order or what have you, a modification of the executive order that's already out there.
Okay, so I guess I'll make a move to accept the claims, the hearing, the consent orders. Do we need a second?
I will second.
All right, any opposed? Okay, very good. Sorry, Eileen, go ahead.
No, that's okay. Also, one thing that's not on my agenda, I'm going to slip in here, is the Variance Committee. We have a Variance Committee that reviews any requests for variance of our sanitary code. And I have 3 people on it, and one person's membership has expired. And so I would like to ask the board to reappoint him. Carl Weizelis, he's been a Variance Committee member for the past 3 years, and his membership expired at the end of 2020. He's a very active member of the Water Quality Management Agency. He's a member of the Central New York Waterways Incorporated, which previously was known as the Seneca River Cross Lake Association. So can I get a motion to appoint him? To reappoint him?
I'll motion.
I'll second.
Okay, great. The next thing I wanted to talk about was the septic replacement program. So the state has given money to help homeowners pay for the repair of their septic system if they're fronting priority water bodies or 250 feet from those water bodies. And so in our county, we're lucky enough to have 4 water bodies who are eligible: Cayuga Lake, Owasco Lake, Skinny Atlas Lake, and Lake Como. Round 1 of this started in 2018, and Lake Como wasn't eligible then, but they are now. So round 1 was for $225,000. Round 2, which starts like immediately, is an additional $340,000, and that expires in 2026. So we're trying to get the word out. We've issued a press release regarding this program. We also are going to mail postcards to lakefront property owners because we have their addresses. They're in our septic database program, and hopefully get people to utilize this program. It will pay 50% of the cost of upgrading your septic system up to $10,000. So it's a great deal if somebody wants to move forward and upgrade their septic system. Any question on that?
Eileen, how is this being advertised? How will homeowners become aware of this?
Okay. We're going to send postcards directly to their homes with this information. I'm going to try to share my screen, but everything's moving slowly. You click on it and there's like a delay. So while I'm waiting for that, okay, it just came up. Okay. Am I sharing it, or are you still seeing it? Can you see the screen?
No, not right now.
You still see me, huh? Okay, let me try one last time. I'm sorry, this is driving me crazy that when I practice it before this meeting, it moves so much quicker.
There you go.
And maybe it's, oh, you can see it?
Yes, now.
Okay, great. All right. Okay, so before I talk about this, I'm also going to mention that at the meeting last month, we talked about the TMDL report for Cayuga Lake, and a letter went out per the board's request, and they did extend the comment period so on that TMDL. So that's been extended to July 8th. So thank you for that, the request to send that letter out. Okay, Hydrilla. So back in 2016, Hydrilla was discovered in Cayuga Lake in front of the Wells College, and the area there in purple, which is surrounded by the purple there, that has been the main treatment area for a number of years. It's about 30 acres. And over the past couple of years, however, the Army Corps of Engineers have been monitoring the whole area, the whole blue area, light blue area shown here. And so typically, they're treating in the purple area using fluoridone, and then they're spot treating in other areas when they see some smaller patches that are outside of that with copper. And they also have been performing checks on where they do these periodic point intercept surveys throughout the growing season. And so last year, if you look at this chart, you can see where they've seen some, where way up north, they saw a moderate growth there. A little further south, they found some more. So there's a couple areas where they just are persisting in spite of the treatment. So they saw 4 patches last year, which are indicated on this report. Two of the patches were seen within prior to completion, prior to the treatment starting, but then they weren't seen later. So it's thought that that was addressed. Other ones were noted, they were treated with copper, but they were still noted at the end of the season. Let's see, I've got another. So this area, when they went back in the fall of 2020, they saw some significant growth up in the area that's like the hash mark. So for this year, they're proposing to not only treat with fluoridone in this purple area, but also in the hash mark area. And then they are planning on applying copper in the little green box areas. And what they found is that the treatment is effective, but the suite is persistent. But they did find that, each successive year, the percent occurrence in the area has declined. And I think I have another picture to show you that. Okay, so if you see to the left of your screen with all the red dots there, that was the first year that they were found hydrilla and were treating hydrilla. And then as it moves, across your screen, it's becoming less dense, but more widespread. But at the end of 2020, which is on your right, there were, very few locations. So they feel pretty good about that they are, really knocking this down. And in addition, they are finding that the native plants are not being impacted by this fluoridone. So they are not just killing plants widespread, but they are being very selective. So this year they're going to treat in the area that I just showed you. Probably the treatment is going to start the end of June, early July, depending upon water temperature, and then we'll go for 10 weeks after that. And we will make, like we have, they make public notice to everybody within this area, and we test the water supply at Wells College weekly during the treatment. In addition, we will be testing the Wells College public bathing beach too. And the history of all this testing is we really have not found any issue of concern while they do this chemical application. Any questions on that?
Okay, well, thanks for the update. Very good. Does anybody have anything else for Eileen?
I'll take a second to just say hello and turn on my camera since I couldn't before. How do I turn this on? You'd think with my age I understand this. Let's see. Oh, there we go. Hello. I've met many of you before, but not all of you. And so, yeah, I'm Ani. Hello.
Welcome, Ani.
Thank you.
Okay, very good. Thank you very much. Let's move on to Kathleen. Thanks, Eileen.
So Kathleen doesn't look like she's on, and I know that she was out of town today, returning tomorrow. So I thought she was going to try to jump on, but it doesn't look like she is.
I couldn't mute. She's not doing it.
Oh, Megan just poked her head in. She says that she is not going to be joining us. So if you want to just go to Nancy.
Very good, thank you. And we'll move on to Nancy.
Okay, good afternoon, everyone. We are in the midst of orchestrating our plan for school vaccinations. Next week, we're going to be able to get every school within our district an opportunity to receive vaccine. We have Pfizer that we'll be utilizing, and we'll be getting that from Upstate, the hub, and we're working through those plans. So that's good. We are doing second dose farm worker clinics this week. That is happening. We've had a J&J clinic. You know, we're trying to utilize the vaccine that we have, but also provide offerings so people have choice. We're doing that. That's kind of consuming most of our time, just getting those things in order, as well as looking at homebound. Kathleen and I have met with home care services, and we have getting things underway for that to happen. That will be great. We will be working with 2 home care agencies, and one will go out and do a list that we provide them. The other home care is going to canvass their patients and their patients' families and caregivers and be able to be that person, and we'll provide the vaccine. We have a system worked out. We just got to finalize that. So that is happening. And I will entertain any questions, but I think that's the main thrust of what's going on from my perspective.
Nancy, can you give any sense of how accepted the vaccines have been in the school setting?
Well, that's a good question, because really last week I would have said we were planning on probably about 20 people on average, so 20 students that we would, but we've seen an uptick in interest. And so with Upstate, we've made arrangements that will pick up vaccine, and we've been told that whatever we need will be available. So we'll pick it up twice in a week, Monday and Wednesday, or Sunday and Wednesday, so we can revisit what we need on Wednesday based on what we use for Monday, Tuesday. And yeah, it's a kind of a moving target, but we've been in communication with superintendents and with their nursing staffs, and just in the conversations they're having with people and nurses, first and foremost, that really helps. And the educators, we're seeing an influence there. So we're hoping for more than not. So that is interesting.
Nancy, following up with Dr. Archer's question, I read an article about Hamilton County. Apparently, Hamilton County, which is the poorest county in New York State with the lowest population, has the highest incidence of vaccination. And they attribute that to the buy-in that they got from community members. Really, the word being spread amongst their own respected community members. I'm wondering if there's a strategy like that for the schools.
Well, I think so. When I talked to the nursing staffs yesterday, they know these students and they know these parents. And so we have some educators working within the school on the same wavelength. By interaction, we can influence, and I think we're seeing that. Also, the school nurses are going to be looking out, as I've explained to superintendents, a barrier that we've identified, and not surprising to any of you, but if the parent or the adult can't read or comprehend, we have offered to assist them, and that we have seen that. I have seen that work. So the school nurses are going to target possibly those persons that might have those issues, those parents, and make personal contact and have a conversation to what you speak to. Yes, I believe that's really important. And that's the same that we're working with our clergy group, because they have relationship And there's tools being developed, and there's already information that's been sent to the clergy, but they are reaching out and we're providing them information. And I know there's other things going on about creating some marketing tools to get that out through that group. So yes. Does that answer to your question?
Well, pretty much. I would hope that even the parents-teacher organizations, of course, the school teacher organizations, and all the people invested in the schools, especially the parents and people in the community, at the very least, just ensure that all the good information is out there. Right. Whatever people choose, that they truly understand what's going on. So, yeah, that I would hope that there's that sort of a push.
Well, we've also recognized that we recognize this as a first swing in trying to capture students while they're still in school, but we know it won't be the end all or be all. Because, for instance, with farm workers, we're having second dose clinics tonight and next week for second dose. We already had calls that some persons have changed their mind and they want it. Well, we're going to accommodate them. We're going to do some first dose clinic. We're going to do some first doses tonight as well. We want to bring these people in the fold, and we know that they may have changed their mind or whatever. We're just happy to be vaccinating them. So we're accommodating that. And we expect the same in the school scene.
That's great. Thanks, Nancy. And I think as more folks get to talk to each other, I think a lot of this information will be out there. But I think it's definitely worthwhile to try to get any group involved with, that community to really, get them informed and get them out there and talking to people.
We did an on-site mobile at Malone Village last week. And, we ended up canvassing the premises there. It was a small volume of persons that attended the clinic. Flyers went into every mailbox. We made door-to-door stops. Again, some people didn't even want to talk to us about it. They didn't want it. Again, it was just our first round of that. We surely will have other clinics, but we are going to them. I think that for the persons that came, we captured, they needed for us to come to them. So we're doing that.
Thank you, Nancy.
Mm-hmm.
Nancy, another group, if you haven't already engaged them, I was thinking would be helpful, might be coaches for sports, given the fact that those people want to continue their sports.
Yes. Right. Good one. Mm-hmm. Mm-hmm.
And even some of the summer leagues and the summer traveling teams, especially the summer traveling team.
Yeah, that's a good idea to explore. Mm-hmm. Mm-hmm. Thank you.
Anything else for us, Nancy?
I can't think of anything at the moment.
Does anybody else have anything for Nancy? Okay, very good. Well, thank you, Nancy. Thanks for the update.
Mm-hmm.
All righty. I guess if Dr. Joy is here, we can have Dr. Joya.
Oh, it is encouraging with the information on the COVID vaccine for 12 to 16-year-olds and 18-year-olds catching up on that group. And there's trials they think will be done by September for the kids even down to 5 years old and possibly 2 years old. That probably wouldn't be ready for use until October, yes, but we see some results in September, the end of September, so it would be good. And the mask wearing, I'd agree that's kind of ambiguous. If you got a store that wants people to wear masks, and it's not a policy, we probably shouldn't be involved unless there's a public nuisance or public health nuisance or a especially serious problem such as someone who knew they had COVID and they were sick and they were coughing all over people, then that's a public health problem. Hopefully we won't see any of that. But certainly will be interesting if people ask us to confirm immunization statuses. Certainly for people who have had the COVID vaccine, it does show up in the New York State immunization registry, so healthcare workers could verify it, but hopefully we won't be called on to do it, and most people will be honest to what's happening.
I'm going to say it's encouraging to see that the clinical trials are ongoing and that the information is continuing to flow. And so far, it seems like the adverse effect rate seems to be pretty low for most of the vaccines. So that's been good too.
Yep.
Anything else for us, Dr. Joya?
Just the basic stuff for watching out for sunburn and motor accidents, injuries, motor vehicles, drinking, texting, sleeping while driving is all dangerous as usual. And always helps outdoors, get some fresh air and avoid COVID, but don't get burned doing it. And watch the ticks.
Sound advice.
Basics.
Advice. Very good. Thank you so much.
Yep.
Okay. Anybody else have anything that they want to bring up for today's meeting? If not, I will take a motion to adjourn.
I'll move.
Okay.
I'll second.
Very good. Thank you so much. Thanks for everything. We'll see you in June.
Bye.
Bye, everyone.
Yeah.
Happy Memorial Day.
You too.
Thank